This is Dr. John Bennett, broadcasting on the Larkin Hospital TV Neurosurgical channel today, and also the neurosurgical.tv channel. Today we have the pleasure of having Slaven. He's a medical student from Croatia, and he's a passionate neurosurgical student. And today he's going to talk about the life and times of Harvey Cushing. And we have a distinguished panelist with us, the ubiquitous Simon. And Simon, why don't you say hi to the crowd?
Hello. So great to be here as always. Slaven, I'm looking forward to your presentation. As you know, I'm a medical student also and a developmental psychologist, and thank you for teaching me so much about neurosurgery.
Yeah, Simon's a little muted because it's 2 or 3 in the morning over in Japan. Yeah. And the star of the show, Slaven, welcome.
Hello everyone. I'm very glad to be here, and I would like to thank to Dr. Bennett and Simon for such a great collaboration and for the opportunity to present something like this here, because this was kind of special presentation that I made for the Rotan course I'm leading here in Zagreb. This was a course that's tried to bind together medical students who are interested in neurosurgery and to provide them with what is neurosurgery and with some essentials to understand what's happening in the operating room. So I would like to proceed to the presentation now. I would like you to consider this presentation firstly to say is a thing that I try to add to the very hard task of giving a presentation on the life of someone as big as Dr. Harvey Cushing was. He was one of the leading neurosurgeons of all times, and he was also the father of modern neurosurgery. So I would like to you to consider my presentation as based on anecdotes from his life, and is a part of more of try to understand him and who he was, how he was perceived, and how many great things he has done. So and also I would like to take you after the presentation into the operating halls of the Peter Ben Bryan Hospital in Boston, where Professor Cushing was operating, and to make you a part of his team. So let's start. I'll just try screen sharing this. Okay. I hope you can see the screen.
Yes.
All right. So now we have here the presentation. I'll just wait until it's loaded. So you can see this, yes? Okay. So Harvey Williams Cushing was a man who made the birth of modern neurosurgery possible. I purposely put this in this word because I think he was really the one man who was responsible for all the essentials that were needed to be undertaken to make operating neurosurgery possible. We are now talking about the time of the end of the 19th century, when neurosurgery, along with the cardiac surgery, who developed the latest only around the end of the World War II, they were considered impossible. So this was due to because of many things that should have been done in order to be able to safely operate the brain. So now I would like to start with a short video. Okay.
So, toast is burning.
Toast is not. Every time she has a seizure, she smells something burning. Now, if we can provoke that smell by probing the surface of the brain, we'll find the source of the seizures. Mrs. Gold, do you feel anything?
See the most wonderful lights.
And now what do you feel?
Did you pour cold water on my hand, Dr. Penfield?
Now what?
Oh,
What is it, Mrs. Gold?
burnt toast. Dr. Penfield, I can smell burnt toast. Dr. Wilder Penfield. He cured my seizures and hundreds more. They say he drew the roadmap of the human brain. We just called him the greatest Canadian alive.
Yeah, no, I don't know about the greatest Canadian alive part, but I think he really is one of the greatest neurosurgeons, certainly. So this is Dr. Wilder Penfield, and I know this presentation is on Harvey Cushing, but allow me just this little introduction into the life of Harvey Cushing via this man. I think Penfield is important because he did some things that were considered original in neurosurgery. So he's the author of the homunculus. We can see it here. So that is the map of functional areas of our brain that made functional neurosurgery possible. And I think it also made every procedure based on the cerebral cortex possible. Because we can see here certain areas of the cortex that Dr. Penfield meticulously captured with his brain stimulation procedure. So he would use the wand, a little electrical current producing stick that would make that would stimulate these areas and give a response. And he would map these responses and then add to them a certain function they do. So he was considered the first one, but I would like to show you in this presentation that he really wasn't the first one, and that he owes a lot to Cushing for his procedures. The video that we saw was the one on the epilepsy. Dr. Penfield was operating epilepsy, and while doing this operation, he found that there are certain engrams, certain neural circuits that are pathological in the temporal lobe of the epilepsy patient. So he could provoke these very complex auras that would precede the epileptic seizure, and that made him the idea to map these areas. So he kind of was involved into areas that made him possible to map all of this. Cushing wasn't so a functional neurosurgery-oriented neurosurgeon, but he did some essentials for this, as I will show later. So this is also a homunculus, some artistic picture of it, just to see the biggest areas on this slide are the areas that are most innervated, so don't get confused. Okay, so now these are just some of the quotes of him. The brain is the organ of destiny. It holds within its humming mechanism secrets that will determine the future of the human race. And we can see how many the neuroscientific researches are today, how important they are. We can see that this sense is preserved. People are thinking about brain today as well in this manner. And also here he is describing one of his anecdotes with the patient during the epilepsy surgery. When one of these flashbacks was reported to me by a conscious patient, it was incredulous. For example, when a mother told me she was suddenly aware as my electrode touched the cortex of being in the kitchen listening to the voice of her little boy who was playing outside in the yard. These are these complex auras that he could provoke with brain stimulation. And now let's just have another break in our presentation that will lead us into the more serious part of the presentation. Okay. So let's start.
Okay, let's see what we got here.
This is completely unethical.
My hours are unethical. I don't have time to sit around searching tons of travel sites looking for flights and hotels.
Just use kayak and compare assignment to travel sites in seconds.
Well, I guess you're the brains of this operation.
Compare hundreds of travel sites at once.
Okay, so I put this in just to show you that this is not brain surgery, okay? So there are limitations to every method. So although there is a wide amount of mapped areas of the cortex, neurosurgeons, they are not able to do anything. So I think this video is really a comedy, and it should be taken as that. But it's kind of a very emphasized video on the social network, so I wanted to put it for people who will watch this later. So now we are back in about 1920s, and we are now viewing a scene from the operating hall of the Peter Brand Hospital where Dr. Cushing is operating. He's on the top of the table. We will go into this into a bit more detail then, but I would just like you to see here that how sophisticated this looks even for this time. So neurosurgery was only in its most essential and developing days, but they already had a certain establishment of the operative theater and ways to operate. These ways very differ from the ways that are used today, but it is very interesting to go back and try to understand how this was performed then. It was technologically much more complex then than it is now. Okay, this is also Dr. Cushing. You can see him now in the job, a great man operating. So now this is a kind of blurrish picture, but it shows Dr. Cushing writing down the procedure he just had. So he was very disciplined in this way, that he would always, after every surgery he has undertaken, he would sit down and write down all the important steps, and he would always illustrate this with the pictures that he considered the most important. Dr. Cushing would use a medical illustrator, and he is one of the persons that are perhaps the most responsible for the establishment of medical illustrator as a profession. And his work also founded the first medical illustrator school in Harvard, I think. So he was always had a medical illustrator who was there in the operating theater and would document all the procedures that he made. But also he himself would do this, and he really left a large amount of material to be taken to see later. So this is Cleveland, the birthplace of Professor Cushing. You can see now he was born on April 8, 1896. This is important. Here are just some pictures from his childhood. Professor Cushing as a child, then with his family. This is an older picture. He's not really a child, but this is his later family when he was married and having his children. He's here. So now Professor Cushing had few moments in his life. We can say that kind of very much influenced who he will become. So this is one of the maybe most important of these moments. This is a picture from the Cleveland Manual Training School. This is the special kind of school that would teach children how to use their hands. And we can see all the kinds of instruments they have here. They had all the kinds of manual classes included into their standard program. And Dr. Cushing himself considered this to be a large part of why he would become a neurosurgeon and why he would become such a great neurosurgeon, because of his manual dexterity. So now he started medical school at the Yale School of Medicine, and then continued in Harvard, where he graduated. So Professor Cushing, as a medical student, was very passionate, as we can see from some reports and documents that were left from that time. He would also illustrate, and he started developing his illustrating skills from that time. So we can find some hernias like inguinal hernia that were pictured masterfully from him, or some other things like some endocrine problems which we can follow as part of his interest later. You all heard about Cushing disease, so I think he really gathered knowledge and really tried to round himself up as a future professional. So then he had the opportunity and a great happening that he met Dr. Halstead. William Stewart Halstead introduced him to the Massachusetts General Hospital, where he started his internship and then residency in general surgery under Professor William Stewart Halstead. The neurosurgery as a specialty then did not exist, so he could not take neurosurgery as his residency. So he was a general surgeon in his practice, in his residency. So this is Dr. Halstead, one of the greatest surgeons of all time, also, who very much influenced Professor Cushing, and he was really one of his fathers. And this is one of the pictures that should be remembered during this presentation. I will tell you later why. But a great man, and he really was a very kind friend, some resources say, with Dr. Cushing, who helped him through his career. Now, after this, Dr. Cushing went to Europe, where he studied with some great neurosurgeons of that time, and then became an associate professor of surgery at the Johns Hopkins School of Medicine. This was the first time when Cushing really developed himself and really established as a person who would make neurosurgery possible. So now we can see here the Big Four, or one of the most important professors who founded the Johns Hopkins School of Medicine, and who were also one of the people responsible for making prolonged medical education or making residency possible. So here is Harvey Cushing. This is Osler, as one of the leading internal medicine doctors of all time. He is a man who is said to have made medical students study patient and his disease beside his bed. So he may be called the father of clinical medicine teaching. And now this is William Tyer, and this is Halstead sitting with him. So we can see the other people at the hall at that time. So this is about the beginning of the 20th century. Cushing, when he was young, I put this picture in because just to show you that he was never a crappy-looking student who was really shy, and he had this dandy look. And he always did have this way of making himself not just to look important, but to look like a businessman and a reliable person. So he never looked bad as a neurosurgeon. This is also Cushing from these days, one of the other pictures. And then Cushing met himself with a big problem. After he started thinking about neurosurgery and the state that it was developed in, he saw that one of the most important steps that should be undertaken are animal research. So he started to research the brain of the animals in various models through the years. And before going to the operative hall, he really started and tried to understand how the brain functions. So he started working on dogs and performed much experiments. These experiments included following of these dogs after certain parts of the brain were removed. He inserted glass parts so he can follow some of the functions in the head of dogs, And he really, after all, performing all these experiments, he really provided the essentials for modern neurosurgery. So this research was the basis of what we saw before. This was the basis for Dr. Penfield in his later development of the cortical homunculus. So we can, despite of all the things that Cushing accomplished and was part of, I was really surprised when I saw that he was also part of the homunculus, which is one of the maybe most important discoveries to make neurosurgery possible. Not to mention functional neurosurgery and all the other developments that it made possible. This is again the picture of the homunculus, where we can see two most important gyri, post-central gyrus and pre-central gyrus, or M1 area and S1 area, sensory area, primary cortex, and then the motoric area, motor area, primary cortex. Okay, and now we will try to concentrate more on Cushing as a neurosurgeon. This is a picture of him operating. We can see how this was part of the routine. He's wearing. He really looks like a neurosurgeon that would look today. And I think we can all see the passion he felt for his job, how he was, how can I say it, how he was into this, and how much he enjoyed performing this. It was a matter of life and death to him, and he really gave his best all the time during doing neurosurgery. Okay, so now. He was also one of the people who are maybe responsible why neurosurgery is so slow as a specialty. There is a saying here in Zagreb that everything you do in general surgery you should do twice or three times slower in neurosurgery. So he was said to operate so slow that one of the attending surgeons at his place would ask him, did the tumor ever return or reside during his operation? Because he was said to operate so slow that the tumor really had the time to reappear during the operation. This is him with his colleagues who assisted him there. These are some of his residents later who would always do the craniotomies. So he's also responsible maybe for these early developments in surgery that can be seen today. He was doing the central part of the procedure not to make himself too tired for this. And he had one resident open and one resident to close the wound after the operation. This is Cushing with Karlstedt also, and we can see how this relationship was very, very intimate and supportive between them. Cushing holding a skull, also the important thing to see. And then one of the with this all beautiful things happening in his life, he became the associate professor of neurosurgery at Johns Hopkins. He began developing neurosurgery. He invented all the basic procedures. We will see more of these instruments that he invented later. But these instruments were really the basis of modern neurosurgery, and lots of them are used today. So then one great rupture happened in this. The World War I started, and Cushing was also mobilized. So he reported to serve his country during the World War I, and he was sent into Paris, into France, where he served as a leading surgeon at one of the military hospitals. Okay, so this is Cushing in his military uniform. Okay. And he was positioned, as I said, is in Paris. And during this time, Cushing experimented with electromagnets to try to take out the bullets from the heads of the wounded soldiers. So this is really one of the examples how Cushing was innovative and how much he would undertake to make surgery possible and to help So Cushing, after his service, he was honored by some of the greatest honors for his military service. He was made Companion of the Bath by the British government and received the Distinguished Service Medal by the USA. So he was very established as a soldier too, and he gradually came to the rank of colonel. Then Professor Cushing made lots and lots of innovations in neurosurgery that really changed the way this specialty was working. I would like to start to present this now, and one of the most interesting things he invented was the use of X-rays in the operative course of the patient. So he would use X-rays to see what the pathology was. Pneumoencephalography was then invented by Walter Dandy, and Cushing combined these methods to orient himself. As you probably know, at that time CT was unavailable. There was no CT, there was no magnetic resonance imaging. So he really used these methods to make the outcome of his surgery better and to help his patients the most he had. So he used all the advanced technology at that time. Then this is one of the interesting things. When Cushing traveled a lot through Europe, and in one of his travels he went to Italy, where he met Scipione Rivarocci. He was the inventor of the sphygmomanometer. And while being in his ambulance, he saw this device and he was amazed by how simple it was to measure blood pressure correctly with this device. He asked Rivarocci to get one of copies to take to the USA. And because Cushing gradually became one of the most famous neurosurgeons of his time, people would start to go to him. So he said to have reversed the transatlantic flow of brains and medical specialists at that time. So in the first years, people would go from the USA to the Europe, but then people from all sides of the world would go to the USA to see Cushing operating, and we will see some of these people later, and how there are certain anecdotes connected with this. So while coming to him to visit him, people saw his copy of sphygmomanometer, and this is considered to be responsible for the dissemination of the sphygmomanometer through the world. So Cushing is said to contribute to this also. I think this is really one of the amazing parts in many of them. He also played a pivotal role in the development of the electrocautery. He was doing this with this man. This is physicist William Bowie, who was Cushing's friend. And Cushing asked him, does he think there is a physical possibility, to coagulate the wood, to produce a current that would make something like this? And in co-working with Bowie, he invented the Bowie cauter. This is the monopolar cautery that's used today mostly in general surgery, but this is one of his most famous neurosurgical inventions. Exactly neurosurgical, because neurosurgery required more refined tool to use in its operation. So this is the Cushing forceps, or as we call it, bipolar. So bipolar has this plus and minus electrodes at the top, and it is really most widely used tool in neurosurgery. It is used to coagulate fine vessels and for very fine meticulous surgery that is performed here. The electrical current goes through these two electrodes and causes denaturation of anything that is between them. So then Cushing really using all this advanced technology, he could make something possible that's even a large step for some surgeons today. His mortality rate till 1920s was only 11%, while other surgeons at that time were trying to achieve 40%. So we can see how successful he was in his cases, and how much he performed certain surgeries that other surgeons could not have performed at that time. So he was very important in the development of neurosurgery and in the picture of surgery at that time. So now one of very great illustrations of who he was as a man, I think, is this picture here, because we can see here the headlight, the frontal light he was taking. This is just an ordinary lamp he placed on his head. Today surgeons are using very refined lamps that could be fixed on your scalp, and you can see have great lighting during the operation. But it only took a cable and a lamp to put on his head and fix it, and he used this in the surgery. So I really like this picture, and I really think it tells a lot who he was as a man and how furiously he was performing surgery and developing neurosurgery. So also, Cushing may be known for one of large contributions he made to various medical specialties. As we saw, he participated in the dissemination of the sphygmomanometer, but also he was the first one. He was said to be the first one to make a classification of the brain tumors. So Cushing operated many brain tumors. As we will see later, we will look at the video in which he operates his 2000 pituitary tumor. But doing all these tumors, Cushing never just did the case and left it behind himself. He always wrote down the description of the case report, and illustrated this, and also took samples, pathological samples, that he can preserve and that are preserved up to this date, as we will see later. So he really made this possible. One of his secretaries also, as you will see in the video, was motivated with his work to go to medical school. She finished medical school and then became the brain pathologist. So she really helped him, and they had the whole institute there where they could diagnose the tumor during the operation and then perform the operation of removing the tumor or keeping parts of it in the patient if it was malignant. So this was really important, and this was also a contribution to the development of surgery as we know it today. This is this collection of his tumors I was talking about. So he took whole brains in the abduction of the patient, and he preserved them in these kegs. So we can see how many of these tumors are here, and how many of the brain samples are here. So this is the picture of the Cushing laboratory today that can be visited, and it has been made publicly available. Now, to break this perhaps boring part that was needed to allow you to get a view of what Cushing was doing and how much things he contributed to medicine. This is an anecdote that should break this a little bit into a funny anecdote. I used to ask people here in Zagreb when I had this lecture, what do they think is inside of here? And they were saying probably like, I don't know, like a brain tumor, part of the brain, maybe some other part of the body. But what's inside is this. This is a beef steak. So, yeah, I know it's hilarious. This is a beef steak.
It's too big to be McDonald's.
Yeah, too big for. Yeah, you can never stop your hungry from the type of food they serve there. Okay, but really, this was a beef steak. So this is connected to this man Pavlov. He was one of the leading neurophysiologists of that day, and in the whole, probably one of the greatest neurophysiologists of all time. He's the man who was said to discover the way the brain functions. So he was the man who discovered classic conditioning and operational conditioning with dogs with who he experimented. So the Pavlov's dog is very famous for this, and we can see how close Pavlov and Cushing were. This is a picture from the conference that was in 1929, the World Congress of Physiologists in the USA. So Pavlov was the lion of the Congress. He was one of the most important persons there, and everybody was very eager to meet him. But Pavlov would hang out the most with Cushing, who was very interested to him because he was a real neurosurgeon. And Pavlov was very interested in how neurosurgery was done. He had really little knowledge about this because neurosurgery was not so developed in other parts of the world. So they made kind of a deal Pavlov asked Cushing if he could see his operation, and because he was very, very interested, as we can see, as you will see later. These are just two of them, two of great physiologists hanging out. Cushing, we may also say that Cushing is one of the physiologists because, as he commented later, the one thing I really am sad the most about my friends, the physiologists, is that they have no sense of history, because all they were interested in was science. But Pavlov himself never documented as much as Cushing did. Cushing was obsessed kind of with the documentation of his work because he probably knew that he was doing pioneering things that would mean a lot later. So there are really maybe no one in the history who has so much documents on his work as Cushing, because he documented every single operation he had, every great thing that he has done. This is to present you Pavlov in his work. He was working on dogs, and this is him with his team in Russia doing one of these experiments. So a great scientist and neurophysiologist. And then Pavlov, because he was Russian, I don't know is this because of this, but he could never really put his beard into the surgery mask he was wearing. So his beard, he was so interested in when viewing Cushing operated that it is said that his beard almost fell into the surgical area. So he should have been very cautious about this. This is Cushing explaining to him with his headlight about the operation he is performing, and Pavlov almost tripped over to fell down. And during one of these procedures, now we will return to the beefsteak. During one of these procedures, Pavlov saw Cushing use his electrocautery, which he called the electrical knife. So Pavlov was so amazed with this instrument that he asked Cushing could he try it. And Cushing said, yes, no problem. And after the surgery, he came back to Pavlov with a lump of beef meat. And Pavlov wrote with this electric knife his name into this lump of meat. So this is why this is called the Pavlov beefsteak. And we can see here Pavlov reading on it. And really, if this exists today too, and it can be seen in this lump of meat, the autogram of Pavlov. So this is one of the most interesting stories that he has. Also, as I said, Cushing reversed this transatlantic traveling of physicians, and while the physicians would come to him, he had one typical routine of going around with them. So he would invite these great surgeons, such as Halsted or anyone, Horsley maybe, from all the parts of the world, and he would he would walk with them, and during their walk, talking about during their walking, talking about various things, they would eventually come to a small set of shops. And Cushing would say to him, "Well, this looks like a very nice shop. Should we go inside?" And they would go inside, and it would be a shop that was making jewelry. And the jeweler came to the surgeon and said, "Oh, you, sir, I couldn't help to notice you have such great hands. They are so beautiful. You must be a surgeon." And he said, "Yes. How did you know that I'm a surgeon?" He says, "Oh, I always notice who is a surgeon because from the way his hands look. So I'm collecting the casts of hands of famous surgeons. So if you would be willing, I would be very glad to take a cast of your hands." This surgeon would probably look at Cushing, asking him why, what is this man talking about? But Cushing would encourage him, and they would both make this cast of hand. So this is Cushing's cast of hand, and eventually, of course, these casts of hands were delivered to Dr. Cushing. So he really made every surgeon who visited him has his own cast preserved in Cushing collection. So I think this is amazing, an amazing story, also showing he's interested in preservation of historical facts of happenings, and he's very, very responsible for history of medicine, also development of this, as we can see from these things. This is Cushing in his later years, when he was the professor also there. At Johns Hopkins. He was at that time performing surgery at the Peter Bent Bryan in the operating theater, as we can see later. And Cushing is probably the most known for his work in the endocrine medicine. So he is the one to describe Cushing's disease. And he really was able to describe this because he performed so many pituitary tumors. So he exactly knew what was happening when there was a tumor producing adrenocorticotropins, and that would stimulate the adrenal glands to produce cortisol, and that would make the classical clinical image of Cushing's disease. So this is just a picture resembling all the facts about it. So this is a very interesting disease because it has so much involved in it. It is a syndrome, and also one of the diseases, as one of my professors would say, one of the diseases that you can see when a patient enters your door. It's really one of the rare examples of inspection in medicine, how you can diagnose something purely with inspection, without any other physical examination methods. So when Cushing was doing his surgeries, as I said, he always had a medical illustrator, and this is one of the most, most last parts that I would like to to tell you. So he always had one of the great medical illustrators with him who would illustrate the whole procedure. Brittle was one of them. He was a famous illustrator who would found the Harvard School of Medical Illustrations. That exists today also. Brittle illustrations were so incredible that they really looked like a photograph, only in black and white. But they also included this 3D sensation, and they were really something beyond everything that Cushing himself could do. So Cushing's illustrations were very simple. He would do this like sketches that would resemble the most important parts, but he really valued illustrations because they would always show you what's the most important part of the picture. He was doing these sketches to show the others what he was thinking about when viewing this specific case. But Brittle would show all of this, and in such detail that it was unbelievable. After Cushing and Brittle were separated, when Cushing Cushing went to the World War I, and he really never could find someone like Brittle. So after a period of adaptation, Cushing started illustrating himself and developing his illustration skills, and going from only default sketches that probably everyone who with a bit of talent could make, he proceeded to become himself one of the great, maybe greatest illustrators in medicine. This is a picture that looks most like the illustration that Brittle would do. You can see how precise this is. All the layers of the wound are showed here. You can see so much from this picture. It is not. It is a bit blurry, so we cannot see here. But this is the primary motor strip, and here he's showing the mapping of the cortex. So this picture binds maybe all of the things Cushing has done in neurosurgery together, because you can see how clean this cut is. The dural opening, everything is in its place. The burr holes, and also this is probably this resembles greatly also the homunculus and brain mapping that he was doing. And in fact, this person that he was picturing didn't have the face like this. You could say, how could he picture someone, the face of his patient? How could he get the consent to do this? But he was very intelligent, and he kind of made this procedure. He always would make the face of the person look different. So he added mustache to this person, and when we look at this, this picture really reminds us of someone. So we can say that this reminds us of Halsted or some other mentors of Cushing. And there was one other person who is considered to maybe have had this face. This is Cushing's brother. So Cushing would give this latent message in this, and we can see how his work is filled with these little astonishing things that really talk about him as a man, I think, and show us who he was. Also, Cushing, after every surgery that he did, would have this routine. He would sit and read till 8 to 10 p.m. He was such a passionate bibliophile that he also, throughout his whole life, collected rare books of medicine. And his collection was so big after he retired that the Yale University Medical Library was made with the foundation of his books. He gave all of his books to his university, and we can see how this looks today. So really vast amount of books that were collected and also preserved by Cushing. He had Vesalius and his anatomy books, Eustache and all the other great anatomists and their works. So after all of this, when Cushing retired, he kind of went away in neurosurgery when he was at the top of his game, as it was said. So he didn't want to see his career go into waste. And he, after that, became the Sterling Professor of Neurology at the Yale Medical School. And then, I don't know if this is ironical, I wouldn't say that, but in 1939, on October 9, Cushing himself died of complications from the myocardial infarction. And the ironical part of this is that the abduction of Professor Cushing revealed that he has arachnoid cyst, that he has had an arachnoid cyst in his brain, probably his whole life. So it's very, very interesting. And I also put here the one of the facts from his life that I mentioned, that he was married to Catherine Stone Corwell, and he had 5 children with her, as we saw on the previous picture. This is the gravestone of Dr. Cushing, and this is the banner that is at his gravesite, telling us some of the things that I said. Pioneer brain surgeon and author, he developed techniques for brain and nervous system operations such as local anesthetic, the tourniquet, heart pressure, and oxygen level monitoring. Received Pulitzer Prize in 1926 for the biography of Sir William Osler. And I don't know if you're surprised now, but I didn't want to mention this until this slide. So Cushing also received Pulitzer Prize for his work on the biography of Sir William Osler, who he knew very well. Cushing is also said to have treated neurosurgically his daughter, Osler's daughter, and I think he's tried to save Osler's son, something like that, in World War I. So they were very, very connected, and he really made all these things happen. Now at the end, and we can see here one of the founding sessions. So after the Cushing disease, the Harvey Cushing Society was made. So this is the first session of the Harvey Cushing Society, with Harvey Cushing sitting in the middle. So after this organization was renamed into American Association of Neurological Surgeons, and this is one of the biggest and the most important organizations of neurological surgery that exists today. And there is also an anecdote connected to this, but you will see this in a video that will shortly go after this slide. So just to tell you one more impression about Cushing. Now that we know all the contributions he has made, how his life looked, I would just like to tell you the opinion of one of the persons who knew him. This person stated that Cushing was looking as one of the most intelligent people that you would see. He was very calm and very tactical in his communications, but despite of this, he is also being said to be a very hard, complex person that really not many people could understand. So he was considered a tough character at that time and is considered today. But I would now like to ask you a question after all of this that we saw. Could a man of such innovation, of such humor in his work, could he be so hard? He was maybe complex, but I don't think that he was really so hermetic and unbearable. But also the video that we will see later will show us some of these character trails that really might argue that he really was. He tried to block the view of the camera, even though he knew that he will be taped. He tried to block the view of the camera with his shoulders three times, I think. So really, he was a unique character. And then, after all of this, I would like to take you through this video. I don't know, maybe we can stop the presentation now and have a little discussion about it, because and we can see the video later, because I really think you must be tired. And
No, that's Slaven. It's a great presentation. Thank you for taking the time. Just get off the screen share there, Slaven,
yes.
so we can talk to you personally. Thank you very much for the effort. Excellent presentation. A fascinating individual, obviously very dedicated. And we're joined by Suresh Dugani, I believe the name. Suresh, is that the correct name that I'm getting? Can you hear me okay?
No, I think this is Rakesh.
Well, okay, we'll continue on. Anyways, yeah, there's a couple of questions I have. Boy, he did a lot, and I'm probably like most doctors and most people in the medical profession. Everybody knows Cushing disease, but I had no idea he was a neurosurgeon. And there's one thing you didn't mention in neurosurgery: there's a Cushing reflex. And perhaps Simon knows about that.
Yes.
Perhaps, maybe you could explain what that is.
just the other day, I asked one of my professors about this reflex because there was a very interesting talk on MedShare I had with Simon about one case that had increased intracranial pressure, and I asked him, could Cushing reflex raise the intracranial pressure even more? But my professor said no, it doesn't make the pressure go up. It makes the pressure go down. And this is very interesting, but because Cushing reflex is one of the reflexes that occur when severe brain ischemia occurs.
Yes.
So when there is not enough perfusion in the brain, or when the ICP increases so much that it pressures, that it makes it impossible for the cerebral blood flow to occur, then the sympathetic nerves are stimulated so much that the blood pressure goes up. They really stimulate the heart to its boundaries, and the pressure goes up and makes this blood flow possible.
Mm-hmm.
So this goes intermittently until the blood flow is established enough to not have ischemia occur. So thank you for mentioning this. This is really one of the spectacular discoveries that Cushing made, and I'm really glad that he was a neurosurgeon, a person who really understood these things and used them daily to describe one of these things, and really a great remark. Thank you.
Okay, Simon, do you have some questions?
Thank you very much, Slavin. In all of my medical school career, all of the classes
We're having a hard time with your sound, Simon. I don't know what it is.
I don't know what's wrong.
Something's wrong with the sound. If you want to type the question in, Simon, I'll ask it. One thing I'll remark while Simon's straightening out his typing a question is that anesthesia was invented in Boston, matter of fact. I don't know if it was at Peter Ben Graham or approximately the same time. Now, I don't know if the craniotomy we saw where the patient was awake, if that was an awake craniotomy. But can you remark on that when anesthesia was invented? It was around in Boston, around that same time.
Yeah, the anesthesia was in fact invented in the 19th century, in 1846.
Oh, okay.
Years. So really, there is this is also a great remark, because in Massachusetts General Hospital there is the Ether Dome, and this is the place, one of the old surgical theaters that were not sterile. Only the methods of asepsis and preservation from infection were introduced later. Much later than the anesthesia was introduced. So this was the place where ether was first time used to successfully anesthetize the patient, and it is said to have been like this. And in Britain, one of the surgeons, this is a story from Great Britain, in fact, but when one of the great surgeons there used this to operate a young waiter who was waiting for his operation, and at that time surgery was horror. There is pretty much not too much texts describing this, but some people did manage to share their experiences about the surgery before the onset of anesthesia. And this was so terrifying that it could only be described as a hell on earth. So one of the professors of mathematics, I think, described his disarticulation of the foot joint. It was performed by the famous surgeon Syme himself, who invented this procedure. But it was such a excruciating experience that he really described it as the feeling of being left by the God, by life and his fellow men. So surgery was very fast at that time, and this is also a thing that I would like to say. It took only about 10 seconds, and Cushing was really the first one to start operating a long time, and taking his time to make patients to perform better surgeries that were more precise. So in Great Britain, the experience that I was talking, just to close this, when this waiter was operated, when the ether was administered, he fell asleep so fast and woke up. When he woke up, he said, "Are you going to start?" And the operation was already finished. So this was probably the greatest example of that ether really work, and that it really served as an anesthesia. So really a great story, and they say that this is perhaps the most groundbreaking discovery in medicine, certainly in surgery, because surgery was quite impossible until that time.
Okay, I'd like to say hello to Bernardo de Andrada from Rio de Janeiro. He joined us, and Bernardo, maybe you can remark on. Slaven just gave an excellent presentation of the life of Harvey Cushing, who I didn't even know that he was a neurosurgeon, but apparently he's had some heavy influence on neurosurgery. Of course, he's the one with the Cushing reflex. Are you familiar with Harvey Cushing at all, Bernardo?
Yes, but not so much. But I know something about his history. He was, if I'm not wrong, he was the first to localizate function on the brain, on the brain surgery.
Yeah,
Yes,
Slaven was talking about that. The homunculus, he kind of mapped the brain. He was one of the mappers of the brain, right, Slaven?
Yeah, he did transsphenoidal surgery, pituitary surgery, so another many things he bring to the neurosurgery.
Yes, this is a great remark, Dr. Andrada. I'm very glad to meet you because I would like to invite you all now to view a short video. It's about 15-20 minutes that was provided by the ANS that shows us Cushing doing his transtemporal approach to treat the tumor of the hypophysis. So this is
nice.
Okay, well, Simon, what would you like to do, Simon? Because Simon's the editor here. Should we watch the video now, or you want to place it in later? Or now? Okay. Whatever you want to do, Slaven, that's fine.
So the video is narrated. I think I put the video here because it really is the most important part of this presentation. I really wanted you to see Cushing operating, and it's such an important medical document. To see him operating, one of the greatest surgeons of all time, and I think you will enjoy it. So I just wanted to say another great remark from Dr. Andrada was this mapping. I really wanted to make you see how important this was, because he was the first one to make the essentials needed for this, and it was needed for neurosurgery. Because without knowing of what cortex was doing, what was the function of certain area, you could not perform any approach through the cortex. So he started to invent the eloquent and non-eloquent area system that was used at that time. Today, it is said that there are no eloquent and non-eloquent areas. The whole brain is eloquent, but really. At that time, surgery was performed through the non-eloquent areas, or the areas that would not produce any neurological deficit that was viewable. And this was probably needed to be because of the time, because it was more important to make a patient live and survive from a pathology than to make his surgery. Yes.
To avoid disabilities.
Yes, to avoid disabilities. Okay, so if you're ready, let's proceed to this video. I will start sharing. Okay, do you agree?
Okay.
Okay. So I'm screen sharing now. Okay, so let's go now to this. This is a video provided by the ANS, and they have all the rights of it, but it can be seen on YouTube. But I really would like to express again my gratitude for making this video publicly available, and I really think you will enjoy it now. I will now give the word to the to the narrator. This binds together the whole presentation.
The film opens as Dr. Gilbert Horax starts the injection of Novocaine along the line of the scalp incision. Most of the craniotomies of this time were done under local anesthesia, sometimes supplemented by open mask ether or by nitrous oxide. Also, since 1926, an anesthetic drug called Abertin was administered rectally as a basal narcotic, but anesthesia by intubation was never employed. This film of Dr. Cushing and his surgical team at the Peter Bent Brigham Hospital in Boston was made by two amateur movie makers, Walter Boyd, a surgical house officer, and Richard Light, who held the Cabot Fellowship in the Laboratory for Surgical Research at Harvard. They used two cameras and combined the results into a single film. As far as we know, this is the only record on film that was ever made of a complete Cushing operation. I am speaking in the year 1979, almost half a century after the event took place. During this interval, all of the men trained by Cushing have completed their careers and have retired. The last of his surgical residents, Bronson Ray, ended his own surgical practice just 2 years ago. The film, therefore, has become an important historical document. In Cushing's time, the operating rooms at the Brigham Hospital were pleasant, open places. Constructed in 1912, they drew their light from the high, north-facing studio windows and their ventilation, at least when the weather was warm, by opening those windows. The sounds and the smells of the street drifted in, and we recall one day when two small boys climbed up into one of the poplar trees just outside the windows to get a good view of all that was going on. When Dr. Cushing arrived to take over the operation, he apparently did not see the boys, although everyone else was aware of their presence and was wondering what would happen. When he uncovered the brain, the boys' excitement gave them away. The chief walked over to the window and, looking over his glasses, said very sternly, "If you boys cannot keep quiet, I shall have to send you home." Needless to say, they became silent and stayed on until the end. Invited visitors were many, and a crude movable iron stand gave a good view of the proceedings. Over the years, many of the medical leaders of Europe had stood in these stands, including the Russian physiologist Pavlov, whose long beard, since he refused to wear a full mask, almost touched the open wound. Dr. Cushing was tolerant of these visitors, just as he was patient with the rotation of house officers who appeared. He knew one every 6 weeks, to handle the large assortment of instruments used during the operation. He was one of our great teachers, and you can sense this in the calm, practiced movements of the members of the operating team as they go about the business of this day's surgical removal of yet another brain tumor. One of the important people in the operating room was this husky man of German descent named Adolf, who may well have been an arrested acromegalic. He ruled over the operating room like a master sergeant in a boot camp.
We'll see how
During his final years,
craniotomy is
Dr.
located.
Cushing concentrated on brain tumors, leaving the rest of the field of neurosurgery to his associate, Gilbert Horax. The usual operating schedule was one brain tumor per day, Monday through Saturday. Dr. Horax performed the opening stage, as shown here, which took about an hour and a quarter. Then Dr. Cushing took over for the tumor removal, with Horax coming back to do the closure. On this day, however, because of the cameras and the special occasion of the 2000th tumor, Dr. Cushing stayed on to complete the operation and to apply the post-operative dressing.
You see,
These operations covered 4 to 7 hours, longer than they do today. Hemostasis, mostly the control of oozing from small veins, was what took up so much time. The introduction of clotting agents, such as gel foam and purified thrombin, was still a dozen years away. This technique of turning back an osteoplastic flap was fairly standard then, although it is less used today. 4 or 5 burr holes were drilled, a beveled saw cut was made from within outward on all but one side, and forcible breakage of the temporal bone laid back the flap. Then the operative field was made dry. The wound was covered with warm saline sponges, and Dr. Horax departed while Dr. Cushing prepared to take over.
So craniotomy was very different at that time, as you can see here.
Yes, yes. It's a great video.
Mm-hmm. So very, very complicated and required lots of skill and force, as he said, because there must have been green stick fracture of temporal bone. I'm not sure if this is transtemporal approach, but it seems like that it isn't. But we can see the technique that they used.
Here is Walter Boyd operating his Bell and Howell camera from a position in the visitor's stands.
And now the big man.
Dr. Cushing, right?
Cushing had an understandable dislike for the bloody practices still seen then in German operating rooms, where surgeons wore rubber boots and rubber aprons simply to keep dry.
Dr. Cushing.
Cushing's team wore white shoes, immaculate reminders of the careful hemostasis which was expected of everyone. Dr. Cushing's reaction to the cameras was a mixture of tolerance and impatience. The photography was done with his permission, of course, but the details bothered him, and he tried to control the scene taking. When he felt that something was unimportant, such as the scrub-up, he tried to stop the cameras, and several times he deliberately blocked the view of the operative site with his shoulders. However, this did him little good, for whenever the view from one camera was blocked, the other camera took over. He soon caught on to this and gave up. At the end of the operation, Dr. Cushing wadded up a wet sponge and threw it at my head, remembering perhaps the years when he played shortstop on the Yale baseball team.
So now Cushing is operating. You can see his technique, how flawless it is, and really like great neurosurgeons and professors today, as we can see in the operating halls.
A tumor of the pituitary, although devastating in its biological effects and the damage that it does to vision, is usually quite small and is therefore difficult to demonstrate in pictures such as these. You will have to take my word for it that the tumor was located and that its removal was accomplished. employed a full-time medical artist named Mildred Cotting, whose excellent illustrations are to be found in all of his publications from the mid-20s onward. She had trained with Max Brüdel, the great teacher in medical illustration at the Johns Hopkins Hospital.
As I mentioned in the presentation, Brüdel was her mentor, and she was an artist that was illustrating Cushing's operations at that time, after Brüdel.
Another invaluable assistant was Louise Eisenhardt, who had taken up the work of the neuropathological laboratory after Percival Bailey left for Chicago. Originally, she was Dr. Cushing's secretary, but she had later gone through medical school and trained in pathology to become a specialist in the differentiation of brain tumors. She co-authored with Cushing the large monograph on the meningiomas. After his retirement, Louise Eisenhardt directed the Cushing Brain Tumor Registry in New Haven. She also served as the editor of the Journal of Neurosurgery from its first issue in 1944 until 1965, an editorial labor of 22 years.
So they had the whole institute there, and they could diagnose the tumor intraoperatively.
So they do a frozen section during the operation and identify the tumor.
Yes, I think they did. They did.
Okay.
Okay, this is. I don't know if this is Cushing
The electrical
forceps.
contact, of course, was made through whichever hemostat or forceps was holding the bleeding vessel. This modern version of medieval cautery, developed at Harvard, had been available to neurosurgeons only since 1927 and was invaluable in controlling small vessel bleeding in deep holes. General surgeons who are watching this picture may be wondering about the sponge count for those small cotton pledges that were used to soak up fluids and were often pushed into corners and left there for a time to control bleeding. Well, there wasn't any practical method of counting those elusive things, although nowadays they are attached to threads. The nurse made up a good supply in advance and continued to replenish the supply all through the operation. So a vigilant watch was kept by the surgical assistant to ensure that none of them was left behind when the wound was closed, and this led to some anxious moments. On one occasion, during an operation on a cerebellopontine tumor, Dr. Cushing had inserted a pledget of cotton in the angle, and the assistant had not seen him take it out. He began to worry about it, but only after the chief had closed the dura, the muscle, the subcutaneous fascia, and the skin with his usual meticulous care, did he summon up the courage to say, "Dr. Cushing, did you mean to leave that piece of cotton in the angle?" Without a word, Dr. Cushing picked up the scissors and removed every stitch, looked up in the angle, removed the piece of cotton, and closed the wound again, layer by layer. The unhappy resident who told this story went on to say, "A few days later we did another posterior fossa tumor, and Dr. Cushing again put a piece of cotton into the angle to control the oozing. I kept my eye on that cotton for 4.5 hours, and again hesitated, on the verge of calling it to Dr. Cushing's attention, until the last stitch had been put in. Just as before, Dr. Cushing reopened the incision painstakingly, looked at the angle, and what do you think he saw?" The resident groaned. There was not a thing there.
So he was very patient. Very patient.
Well, you know, most surgeons I run into are. They have to be.
At this time, the training centers for medicine and surgery were relatively few in number, and the appointments were highly prized. In the three major Boston hospitals, all of which were connected with medical schools, competitive examinations were given. The applicants were required to be single, and it was understood that marriage would not take place until the full training was completed. The starting salary was $300 per year for house officers and rose to a handsome $1,800 at the resident level. How things have changed. Today's resident can demand as much as $18,000 a year.
Yes, he had a contract for his residents saying not to marry during their training. So this is very interesting. He wanted them to full time.
While the necessarily slow business of closing the wound goes on, let us consider the wide-ranging influence that Harvey Cushing exerted during the last half of his career. His reputation had been building for a long time, growing stronger with each resident sent out to establish neurosurgery in this or that medical center, and with each publication of new advances in technique, or in wisdom, or sometimes simply in courage, that he made in this largely unknown field of surgery. Numerous honorary degrees were now coming to him, including the Doctor of Science, which was awarded by Harvard University 2 months after this operation. Later that same summer, at the first International Neurological Congress held in Switzerland, the ovation given Dr. Cushing was so great that William Henry Welch, who took part in the Congress, said to a friend, "Cushing is undoubtedly the outstanding medical figure of the world today." Harvey Cushing was one of the reasons why the transatlantic movement of medical men reversed itself. In earlier years, young American physicians had flocked to Europe, as he himself had done, to sharpen their skills under the famous leaders of the time. Now Europe was turning to America, coming over in droves to the teaching centers in this country. By the end of his career, more than a dozen Cushing-trained men were practicing neurosurgery in Europe and the British Isles, and at least 24 others in the United States and in Canada. Contributing to the importance of American training centers was the growth of experimental laboratories in our medical schools. Here again, Cushing had been a pioneer, and his biographer, John Fulton, states that one of his most significant contributions to American surgery lay in the establishment, in 1901, of the Hunterian Laboratory at the Johns Hopkins Medical School. The Hunterian was destined to become the forerunner of all other experimental laboratories, including the Laboratory for Surgical Research here at Harvard. The Harvard Laboratory stood across the street from the Brigham Hospital. Since Cushing controlled the appointment of its director, much of the research of the laboratory moved along in the same direction as the studies on humans which derived from his surgical practice. Thus the Cushing team was broader in scope than the gowned and gloved people seen in these pictures. It was a concerted enterprise, driving steadily forward through research and development and on into publication. The published works of Harvey Cushing fill several feet of bookshelf space. The earliest, and one of the most famous of his monographs, was called The Pituitary Body and Its Disorders, which grew out of the Harvard lecture which he gave in New York in 1910. Since the pituitary is one of the most complex of the glands of internal secretion, the unraveling of its secrets, and of its several types of tumors, occupied Cushing until the end of his days. Not all of his writing was in the field of science, however. His 2-volume biography of William Osler, which appeared in 1925, won worldwide attention, and it included a Pulitzer Prize. In addition to his practice in neurosurgery and to his writings, Cushing was a persistent and tireless collector of early medical books and pamphlets. These treasures he bequeathed to Yale University, which built a special library to house them. When the list of his rare books was finally released by Yale, a British reviewer called it the greatest collection of books left by a medical man since William Hunter willed his great collection to the University of Glasgow in 1783. To To accomplish so much in a single lifetime is one of the marvels of his career, since he carried on the life of a surgeon, the life of a bibliophile, and the life of a writer in different parts of the same day. He was at the hospital from 9 in the morning until 5:30 or 6 o'clock in the afternoon without a luncheon break, because he had tea and toast in the dressing room while dictating the operating notes. His writing was done at home, in the evenings. He often had staff members come for dinner with his family, but around 8 o'clock he skillfully ushered us out of the house and then retired to his study to work over books and papers until midnight. His working day covered 13 or 14 hours out of the 24. As the surgical drapes are laid back, we can see how little of present-day technology was in use then. None of the expensive and complicated life support mechanisms that we know now had yet been developed. The only systemic monitor was a woman anesthetist buried under the drapes, sitting on a low stool, who checked on blood pressure and pulse and respiration, and occasionally administered a whiff of ether or of gas. The surgeon of 1930 was like the airplane pilot of the same time, who had to rely on experience and judgment because there was no other technology with which to find his way from here to there. The most serious deficiency of the time was the lack of blood bank and the inability to administer fluids and drugs continuously into a vein. Fluids were given, if at all, by insertion of a long needle into the deep tissues of the thigh. Transfusions were made direct from donor to receiver in what was often a desperate last-minute attempt to save an expiring patient. Post-operative infections, however, were virtually unknown. The discipline of the operating room was never broken, and its philosophy was written on the wall of the surgical laboratory. In this room, it said, godliness is next to cleanliness, and for a reminder there was a stiff brush fastened to the wall in case anyone needed to scratch his face. The long hours of open wound exposure, the lack of filtered air, the open balconies, the entrance and exit of many people, none of these modern horrors had any damaging effect on the Halstead principles of tissue handling, as they had been preserved and elaborated on by this pupil. Dr. Cushing's results were indeed marvelous. When he entered the field of neurosurgery, the operative mortality for brain tumors was well over 70%. By 1920, he had lowered his own surgical mortality to 20%. By 1929 to 10%, and then, on the final stretch, down to 4%. No one could do it any better today. One of Cushing's many talents was his ability to sketch, and his case histories are generously illustrated with pen and ink drawings made as soon as the operation was finished, which show the various stages of the procedure. These were useful later on as he worked up the cases for publication, and they were also helpful when patients came back for further surgery. This short ceremony had been planned for weeks in anticipation of his performing the 2000th brain tumor operation. Although Cushing's operative career still had a year and a quarter to run, A special demonstration seemed appropriate to this occasion. We do not have a record of what the speaker said, but no one could say it better than John Homans, who had worked with Cushing since his work at the Hunterian in 1908, and who spoke with a cheerful and bunch of frankness that everyone enjoyed. I am sure that he said just the right things to make Dr. Cushing feel good.
This is the silver cigarette box that every president of the ANS had since then.
Give me the beef.
Part of each floor was an examination of the patients who had been operated on during the preceding 6 or 8 days. Dr. Cushing usually took care of this himself. The patients were brought back to the operating room, not on stretchers, but in their own beds, with their heads turned to the foot of the bed. The journey was made over a long pike, open to the weather, with 2 or 3 people tugging and pushing the clanking beds along on their wobbly casters. Once in the operating room, however, things were quiet, as always. One by one, the dressings were removed and the surgical field laid bare. Sutures were cut on the second day and left in place to be removed on the day following. Back in 1905, when Cushing first turned his attention to the surgery of the brain and the spinal cord, he requested that all his patients write to him on the anniversary of their operations. This practice enabled him to collect data concerning the end results of his surgery and ultimately to learn of the probable life expectancy of patients having a particular type of tumor. At the time of his death in 1939, he was still following nearly 1,000 of his living cases of verified brain tumor. What better indication could there be of the dedication of this great physician to his work and to his patients?
Okay, so
Well, very good, Slaven. I think we're going to wrap it up now. I just like to ask Bernardo a question, and maybe you could help me answer it too, Slaven. Was it Bernardo? Are neurosurgeons noted for being slow operators? Because I don't think you were here when Slaven was talking about it, but he mentioned that Dr. Cushing operated very slowly and meticulously. Well, I guess Bernardo's gone. Is that true, Slaven? Are neurosurgeons noted for that today, for being relatively slow in the operating room?
well, I have experiences from various centers here in Zagreb and from other parts of Croatia.
Good afternoon, everybody. That's loud enough.
Who is this?
My name is Josh Fiddler. I have the honor and privilege of chairing the
That's the video playing.
and
I think
introducing.
you have to shut that video off, Slaven.
Welcome to the installation.
Okay, well, I think we're going to wrap it up, Slaven, okay?
Okay.
Well, there's Bernardo coming back. Maybe we'll ask him. Bernardo, did you hear the question I asked?
No, sorry.
Okay, during the presentation, Slaven mentioned that Dr. Cushing was noted for his very meticulous, slow manner of operating. Is that typical of neurosurgeons? Are they noted for being very slow and meticulous, or that doesn't apply today?
I think it depends. I know some neurosurgeons that the surgery don't run, don't walk.
Oh, okay.
And another ones are more meticulous, and others are more likes to be more fast.
Right.
I think there are two types of surgeons, you know.
Okay.
Some things that I could observe in the presentation,
Okay.
that there are some things that are so similar to nowadays, like the technique of opening, of closure, the instruments, and there are other things that are so different, like the anesthesia
Yeah.
and the wearing of surgeons during the surgery.
Yeah.
Very
There's.
good. Thank you for showing us these presentations.
Yeah.
Very, very great.
Let me just a quick remark. They had no IV solutions then. That was amazing, and they couldn't transfuse blood.
Yeah, something curious was the silver foil.
With
uh,
silver foil.
yes, I didn't know
Yeah,
it.
there were a lot of but a great video. Well, I don't know where you got that, Slava, but excellent video. So I'd like
Uh,
to thank you, Slava. We'll wrap it up now, and we can hang around and chat. Thank you very much, Slavan. If you do a
Thank you.
presentation like that during the conference, you will be a lion of the conference.
Thank you very much. I don't think so, but thank you very much.
Thank you,
They're
Bernardo,
really,
for coming. Thank
really
you,
good.
Simon. Thank you.
Mhm.